of the sterility do not change. I'm just showing it to you guys. If I turn my back, you will not be able to see anything.
Oh, okay.
So that's why I'm keeping it here. But you always have to remember, head is cleaner than feet. Right? So I see sometimes nurses are trying to do things on the bed, somehow, on this table, somewhere. Yeah, sometimes we have to improvise because there's no other way, right? So, but we always need to remember what are the principles, what are we breaking, and what it might cause our patient. So that's why I'm showing you best practices, and you decide what you're gonna do when you're there. So now I'm gonna go through the checklist. Hi, Mrs. Smith. How are you? Where's my Mrs.?
Good.
Good, right? So I'm checking the bracelet, right? So the doctor's order says that I need to put the catheter in. You couldn't pee for 6 hours, and your
hurts.
bladder is probably very, very full right now. Is that okay?
Very okay.
Can I palpate your bladder before I start, just to make sure that it's actually full and we are not mistaken?
Sure.
Okay, so I'm gonna open Mrs. Smith. Oh, you have a wound here. Oh, Mom. Sorry, I'll be very gentle. So I'll put my gloves on because you never know what you're gonna find when you open in somebody's privates.
That's true.
So this is regular gloves. I'm just using them for routine precautions, right? So I'm palpating the bladder. Oh, it's full. Are you uncomfortable? Oh yeah, I'm very uncomfortable. All right, so we're gonna catheterize you and you will feel much better. So I'm gonna put you in the, what's that position? Dorsal recumbent position.
Yes.
So I'm gonna lift the bed a little bit higher. So, because I need to see. Sorry, I'll just turn it. Okay. So the patient needs to have the pericare before the procedure, right? Because if the patient had bowel movement or voided, right? So we cannot put the catheter right on top of it. Although I did see people do it sometimes, like everything is prepared, the sterile kit is ready, and the patient is having a bowel movement and they put the catheter on top. This is wrong on so many levels. So even though that, you know, it's a lot of time investment, please don't do it, okay? So they show you a weird way of putting the blanket. You don't need to do that. So what I do with my patient, and I think that's good enough, so you just need to put them in this position and then cover their legs and then put the blanket flat, because this is where you're gonna be positioning your sterile field. So some elderly, they cannot be very bendy, so sometimes it's just one knee that can go up and another one stays straight. Sometimes it's like this, like our mannequin. So you just do your best as long as you can visualize. And sometimes it's good to put the pillow under the bum to make it more visible. So sometimes it's good to have all the lights on, and sometimes it's good to have a helper who would shine the flashlight in the area, because finding the meatus is the most challenging situation. Everything else you will see, it's just prep, right? So the procedure itself, very short and very simple. So we prepare Mrs. Smith until we are ready to proceed. We can keep her dignity. Now I can
Question.
set it up.
Sorry.
Yes.
Do we have to do the pericare always before catheterization?
Yeah.
Okay.
Because you know our anatomy, there are lots of
Yeah.
opportunities for microbes to be in different places. So that's why even when you have to give a sample of urine, they always tell, always wash yourself, right? So to avoid contamination. So that's why if we are doing the sterile procedure, procedure. Providing pericare, it's not only courtesy, it's a necessity, right? So we don't want to introduce something that can contaminate. So I finished preparing, Mrs. Smith. I'm gonna take my gloves off because I don't need them to set up the sterile field, right? So I can use my hands, and they are not gonna be so sweaty before I put the sterile gloves on. So I'm gonna wash my hands. So we already have a soccer pad underneath. So in this case, we don't need anything extra. But if you are using the regular bed linen, like if you're doing it at home, you would put blue pad underneath just to prevent the soiling of the linen, right? Just in case of any leakage or anything. But in this case, we already have it. So when you demonstrate in evaluation, you don't need to put anything underneath. It's already there.
Provided.
It's already provided. So when you practice at home, just make sure that you put something on. All right, so we have a straight catheter, and we have our catheterization kit that's supposed to have everything in it. And it actually says that it has basin, forceps, lubricant, specimen container, fenestrated drip, semi-betadine, swab sticks. That's new, so I don't need to use the forceps. That's good. Pre-filled syringe, cotton balls, vinyl gloves. Those are sterile. They usually don't fit me, but those with small hands are in luck. So if for some reason you guys use your sterile gloves from the kit, you can replace them with the regular gloves. Remember, I showed to you how to fold them nicely and put them in the just the regular A format paper, like letter size paper, and fold the edges. So that is gonna be your pretend sterile gloves. Okay, and you can put them inside of the package so that you don't need to stress about it. So I'm gonna open the kit. So and this is gonna be my garbage. So in this case, our sterile field is gonna be between the patient legs. So that's why I put the garbage over there. I'm gonna be pushing this in some direction. No, stay, just don't get on the way. So where is my end? So remember, the end, I always open away from myself, and I have to be careful because transfer forceps are sitting on top of the kit, right? So that's why just do it gently. Okay, so now here they are. Don't make them fly. So then you turn. So remember, this is not sterile. So now we're gonna put our drapes, and we're actually going to use them. So we have the swab sticks. I'm not gonna use them because they're gonna stay in the mannequin. So I'm gonna use the cotton balls. So leave them here. These are the sterile gloves.
My hands are getting
Should
tired.
I attempt to put them on? Let's attempt. You see how weird they are? Not folded at all. And this is what you have to deal with. So you just need to find the thumb. One thumb. So we have so we don't need to collect the sample. So the lubricant we're gonna pretend. There you go. And we don't need this because we are not inserting the Foley catheter. We are inserting the straight catheter. So that's why, oops, I don't need it. So what I'm going to do is I'm going to add the catheter now to the field before I put the sterile gloves, because it's not sterile, right? Remember, it was sitting on the shelf, very not sterile. So that's why but inside it is sterile. So I open it and I use the forceps, transfer forceps, to take it gently and put it on the field. When I have my sterile gloves on, then I will put it more accurately. So, garbage. Now, if I have my betadine, it can be like a separate solution, or it can be, let's pretend that this is betadine. So I can take it in my hand, because I'm gonna discard it. I peel it open, and I pour. I didn't touch what's inside, right? I pour it over, and now it's garbage. So the same I can do with lubricant. I can touch the external part and squeeze it out. Peel open and squeeze it in the corner. Some people squeeze it on right here. I find it becomes messy because
they
it's
directly,
too on top. Or they can put
apply
directly,
and-
yes, you can do that. So I like to squeeze it so that it's inside there. It's not wrong what you're saying, but you need to do it when you have sterile gloves on. Okay, so let's do what you're saying. So, okay, scratch. So we have it here. So I'm gonna put the sterile gloves now, because everything that required me to touch non-sterile, I already did. So now everything that I'm gonna be touching is gonna be sterile. So I'm putting my sterile gloves on first, the dominant hand. So I'm touching skin to skin, glove to glove. So I go inside of the glove where the skin is touching. I made it. So now I have the glove on. I'm gonna put non-dominant. So I'm not touching the skin, I'm only touching the glove. See, I can touch the glove all I want. I cannot touch the skin. I wish it would be a little bit bigger. But it is what it is. So you see, I can touch the glove, but I cannot touch the skin. So I'm adjusting it. So and now I can adjust this one, because I want to feel my fingers. Good enough. All right, so now I'm gonna do what you said. I'm gonna take my catheter. Now I can touch all I want, because I'm the queen of the sterility, right? I have sterile gloves. Everything that inside of sterile area is mine. So I put it inside. I take this, I break it, I lubricate it. I lubricate it a little bit more. Now I put it on the side. I have it all here. I put my forceps, right? So what else? Now I need to put this on the patient. So this is on my way. I'm gonna push it away, because I need to apply those. So you see, if you would have it there, you wouldn't have to push it out of the way. So there are two drapes. So one drape is regular, and another drape is fenestrated. So now I need to protect my gloves. Where is my sterility? So you see, my gloves are sterile. I cover them because I need to protect them from touching non-sterile patient, linen, skin, who knows what else, right? I'll show you two ways.
What's the name of this again?
Drape.
Drape, okay.
So I go in there. I'm touching all inside, you see? Not the 2-inch border, but all inside. I need the help. Can you pull the open? Thank you so much. So now I'm gonna put the fenestrated drape. The same idea. You open it. You protect your gloves, right? And you put it on top.
Oh.
Again, you can touch it, the drape. You cannot touch the patient because my gloves are sterile. You see? I cannot touch gown, I cannot touch linen, I cannot touch her skin. I'm gonna show you the other way of applying it without sterile gloves. Those of you who want to do that first and then put the sterile gloves on. So it's either or, whatever you're more comfortable with. Now I'm moving my business to the patient, right? So this is the extension of the sterile field. If something falls, I can pick it up. That's the whole idea. Now, the whole procedure is that I'm gonna contaminate my hand. So just another side note, I'm right-handed. So you see, I'm standing right here because this is the hand that I'm using. If I'm left-handed, I have to be on the other side. This is very important. You cannot cross your hands during the procedure, right? Only like this. So what I'm doing now, I'm taking so before I contaminate my hand, I can, fix things. This is weird. So not after I put my hand on the patient. Okay, now I'm putting my hand on the patient and I open the labia minora to visualize the meatus. And I'm holding it open throughout procedure. It is very challenging because it's a rubber mannequin. It's not like human being so it's very, so I understand your pain, but try to keep it open. So, and we are doing 3 wipes from top to bottom. First, the labia minora away from me, from top to bottom. Garbage. Now the second one. They are wet, so much easier. So now labia minora close to me, from top to bottom. Garbage. And now from the clitoris to the anus. From top to bottom in the middle. Okay? So I'm not discarding it because what if my hands slip? If it closes, there is no more sterility.
Yeah.
So then I take my lubricated catheter and I go right in the first hole from the top. And I insert it until I see the urine coming. Once I see the urine coming, I advance it 2 to 5 centimeters more to make sure that I'm in the bladder. Then I can finally remove my fingers and I can hold the catheter and that I can put in the garbage because I know I don't need this anymore. Now I'm just waiting when the urine drains. That's it. That's the whole skill. So then the urine drains. We wait for a little bit. How you feeling, Mrs. Smith, right? So we are talking to the patient. Do you feel any relief?
A little bit.
Okay, let's give it a little bit longer. So,
should we ask the patient to take a deep breath, hold it, and then those kind of
you
things?
can do that, right?
And
So
then we insert it something?
you can do that. Sometimes I tell the patient, bear down a little bit because it helps to open the meatus. Or sometimes I ask them to cough, just so, and it winks at you.
Oh, nice.
So yeah, you can do all those things, but usually when you are already working with the patient, so I'm about to go, let's do it. So, and if you see it, then you don't need to ask them anything. But if you don't see, if you're looking for it and you're not finding it, then you ask all those things.
Okay.
right? So instead of poking, it's very, very uncomfortable. All right, so far Mrs. Smith is doing good.
Yes.
So now you feel relief. So I see it's getting full now, and it starts just dripping very slowly and finally stops. So now I'm gonna remove the catheter. So hold your breath. I'm coming out, and
Okay.
in one smooth motion, I just pull it out, and I put it in there. So now what do? I look at the amount, the color, the odor, right, of the urine, because I will need to document it. So I looked at it, I can put it here. The first thing I do, I take care of my patient. So I remove all this stuff. So when you guys remove your stuff, don't break it, right, so that you can reuse it. Those drapes. So some people like to change the gloves. If your gloves are not soiled in the urine, then you can use the same gloves too, because it doesn't matter right now, to help her in a comfortable position. And
And
if
we
your
don't-
gloves are soiled, then you change them.
And then we don't sterile again the site, no? I mean after. We don't pericare then after, no?
Oh, because you did it before,
Yeah.
and it's very clean. Like the patient is clean with Betadine.
Oh,
Very
okay.
clean. Sparkling clean. So you put the patient in a comfortable position. You put the bed down. So now I'm gonna take my gloves, or I'm gonna discard everything in appropriate receptacles.
Yeah.
Remove my gloves, wash my hands, and document
The procedure.
how much urine I got, right? So the amount, the color, the odor, and how the patient tolerated the procedure.
Okay.
Right? So
Yeah.
patient tolerated procedure
Just-
well.
oh.
So if we need a sample
If you need the sample, you collect it during when
from,
the urine
from
is
this
dripping.
one,
Yeah.
we get it?
No, when it starts flowing, this is where you
Oh.
put your
Oh, we
collection.
put this.
Oh.
So
Can we take the sample from that sterile container and pour it into the other little blue one? The one with the blue lid or no?
No. You put it in a blue lid, but directly from the catheter.
Yeah. Oh, from the
It's not
catheter.
recommended to
Just
get
scoop
it. Even though that it's sterile,
I know.
it could be some gel
I
in there.
yeah. The gel.
So,
Okay.
no.
That's just too
So,
nasty.
Directly from the catheter. And not the first drop, like you let the first few drops
Yeah.
go, like midstream. Sort of thing. Okay? So I'm just gonna wash my hands.
And then you document everything.
Yeah, and you're gonna document. So that's it today. Fill out all